Project HEAL is a collaborative effort made up of community service agencies such as Catholic Charities, where we are today, Salvation Army, Place of Hope. There's an outreach to Hispanic underserved populations in St. Joe in Wade Park in the church basement, Melrose. Really started as an outreach of Mid-Minnesota Family Medicine Center. What we found is that not everybody's able to even get to the clinic. Variety of barriers to care, such as transportation, lack of health insurance, language sometimes is a barrier, just not knowing where to go. Trust is a big barrier sometimes. And so what MidMin did, on the request of Pastor Carol Jean Smith and Jerry Smith of Place of Hope back in about 1998, they came to the St. Cloud Hospital and asked if they could have some medical services brought out to their homeless drop-in center. Out of that request and the willingness of the doctors and nurses to volunteer their time, they began a clinic one Sunday afternoon a month. At all hospitals in Minnesota, save maybe 2, are nonprofit hospitals. And so any kind of profit or margin that they make is reinvested back into capital, into the programs, into the community, into providing health care. This is one of those areas that they support. We also received early on, we had a grant from Synteker Health Foundation to help do some planning. Then we had a grant from actually the Community Access Program, which was a federal grant that helped really stabilize and sustain the program in the first infancy years. Most of the folks that we see, the people that we see at Salvation Army and Place of Hope are homeless. That's where we started to do outreach, was to that population. And it's a trust thing. I always talk about it as it's a transfer of trust. These community service sites, such as Place of Hope or Catholic Charities, even in Salvation Army, that staff is there working with that population day in and day out. And the clientele then build a trust level with those frontline workers at those shelters. Here at Catholic Charities, these are folks, a lot of these folks here have jobs. Some of them may have health insurance, but they have a very high deductible. Mostly we have a limited scope of service here. So it's basically, I always describe it as what a doctor or provider can do with their stethoscope in their brain. We don't do any labs. Everyone's a volunteer. I'm the coordinator and the director, if you will, of Project HEAL. Volunteer Services does a lot of the backroom pieces at St. Cloud Hospital. We run all our volunteers through that, security checks and health screens and annual education and such. The recipients are very happy to receive the care because you know, it's free and they're able to come in and get some of their needs addressed. And so many times, you know, it's just having the opportunity to sit down with a provider.